Okay, today we are going to treat this model, and as we can see, we can tell by her skin condition, and she's like having the acne, and after the acne will cover, some pigments is formed, and she has accepted the SUSLASER treatment like 1 month ago, so the skin is a little bit reddish after the laser treatment, so we can choose the large tip to treat the skin, and we can help to improve their skin condition while at the same time we can reduce the pigment in the skin. So after checking the skin condition of our patient, and we will turn on the machine and set parameter.
Nice.
Okay, we finished the forehead and the treatment is finished. As we can see, the skin is like reddish and a little bit like bruise underneath, so which is the good sign. And also this side of the face is actually the same, and also the forehead. So after the treatment, we can apply the hygienic or medical facial mask on the treated skin and tell the after treatment care, and we have to wear mask for 3 to 7 days, and we need to avoid direct sun exposure. And for the first 3 days, and the skin will be reddish, which is the normal skin reaction, and we need to pay good attention to the skincare routine. And after that, we do not go to the high heat places like sauna or hot spring. And after like 3 to 5 days, we can go back to the normal skincare routine. So we can apply the PDT after the treatment. So this is the plasma face treatment, and thank you.